Most common causes of hand pain are by far number one is tendonitis. And tendonitis being inflammation and swelling of tendons inside their sheath, which is caused by heavy and repetitive use of the hand, which we all tend to do both at work and at home. Flexor tendonitis is extremely common and underdiagnosed. In its extreme form, it causes triggering or catching of fingers when they move. So most people are aware of what a trigger finger is, but most people are not aware of the pain and swelling and stiffness caused by flexor tendonitis in the same location that causes trigger finger, but just not quite to the degree of causing the catching sensation. So that very commonly happens along with carpal tunnel syndrome and arthritis at the base of the thumb and the CMC joint. And flexor tendonitis in the fingers and the hand causing hand pain is very effectively treated with cortisone injections. And in the severe cases when cortisone injections do not work, then surgery is necessary to release the sheath around the tendons. Early on in the process, if activities are changed and ergonomics is changed and some therapy is done, it is possible to get an improvement in symptoms without injections. But the majority of the patients that I see have been having symptoms for a long time, many months and years, and so usually it requires the injections or surgery. Another very common cause of hand pain is carpal tunnel syndrome and other nerve compression syndromes. The ulnar nerve can be pinched at the wrist and the radial nerve can be pinched at the wrist. So those are the three most common cause of nerve compression syndromes causing hand pain. The pain from pinched nerves is characteristic. It's always there, it's severe, it interferes with sleep, it interferes with use of the hand for daily activities. It gets worse with daily activities and is frequently associated with numbness and tingling. Early on in the process of the nerve compression syndromes causing hand pain, they can be treated with splints, injections, therapy, ergonomics, modifying the way hands are used every day. And later on in the process, the nerve compression syndromes usually do require surgery to change the anatomy so that the nerves are not pinched anymore. Once a pinched nerve is unpinched, it can heal completely and all of the symptoms can disappear. The third most common cause for hand pain is arthritis in finger joints, particularly at the base of the thumb at the CMC joint. But for finger joint arthritis, there are some surgical options for severe cases. Usually the less severe cases do not require surgery. But in the severe cases, joint replacement procedures can be done, as well as fusing a finger joint so there's no motion to get rid of the pain.